How do STI swab tests work in the lab? Imagine going to the doctor because you suspect an infection, and they need to find out exactly what's causing it. That's where STI swab tests come in. The process starts with collecting a sample from the area where symptoms or exposure occurred. This could be the vagina, cervix, urethra, rectum, throat, or even the eye if needed. A healthcare provider uses a small, sterile swab, similar to a cotton swab, to gently rub the area and gather cells and secretions. Sometimes, individuals are instructed on how to self-collect vaginal swabs safely and correctly, which can be convenient and private. Once the sample is collected, it's placed into a special transport tube designed to keep the sample stable during its journey to the laboratory. This tube prevents the sample from degrading or contaminating, ensuring accurate test results. When the sample arrives at the lab, it undergoes a series of precise steps. First, the sample is prepared by releasing the cells and any pathogens into a solution. Then scientists extract the genetic material, either DNA or RNA, from the pathogens present in the sample. The next step involves amplification, which is like making many copies of the genetic material to make detection easier. This is done through a process called polymerase chain reaction, or PCR, which creates millions of copies of specific DNA or RNA sequences that are unique to the infectious organisms. This step is crucial because it boosts the signal, making it easier to identify even tiny amounts of pathogens. After amplification, the lab uses special markers that light up or change color when they detect the genetic material. This confirms whether the infection is present or not. The entire process is highly sensitive and specific, meaning it can accurately identify infections like chlamydia, gonorrhea, or trichomoniasis, even if only a few bacteria or viruses are present. Results are typically ready within 1 to 2 days, although some rapid tests can give results faster, but they might be less accurate. Swab tests tend to be more reliable than urine tests, especially for women, because they collect cells directly from the infection site. The choice of site for swab collection depends on the individual's anatomy and sexual history. For example, vaginal swabs are common for women, while men might provide a urethral swab or a first catch urine sample. If there has been oral or rectal exposure, swabs from those areas may be taken as well. In summary, STI swab tests work by collecting cells from areas where infection might be hiding, then using advanced molecular techniques in the lab to detect the genetic fingerprints of the germs causing the infection. This process helps healthcare providers diagnose infections accurately and quickly, so appropriate treatment can be started to prevent complications and stop the spread of STIs. Always remember to consult a healthcare professional for personalized advice and testing options.